Divine Noni, ஆரோக்கியத்தின் அடையாளம்.
You can practice after the age of 40 to prevent any type of heart related problem, and whenever you feel that any person has got a heart attack, as you are taking the person to the hospital, please start doing this point. This is as good as a cardiac massage, and you can be able to save a person's life. There is no better joy than trying to reach out to the people and save somebody's life. It has got a different satisfaction altogether. And you are the people who are traveling. You are the people who are in contact with a lot of people in the society, in the community. You can spread this message, and in turn, directly or indirectly, you are helping to save many people's life. This is the point which we have shown on the left hand side, little finger. This point, if it is done at the time of heart attack, this is a life-saving point. And on a regular basis, even after the age of 40-45, if this point is done, this can help to improve the muscular condition of the heart and improve the condition of the heart, prevent heart-related ailments. People who have already gone through surgeries, they can also do this point. This will be useful. There is no better exercise for the heart than reaching down and lifting people up and bring them to the mainstream of the society and keeping them alive. Stroke, paralysis stroke. How do we identify a stroke? Again, because of the ignorance of the people, many a times we try to keep postponing things and not get adequate attention in time. We feel that it must be just a headache, or it must be just a nauseatic feeling, vomiting feeling. That is why the person is not feeling well and is complaining about the giddiness and the head related problem. At times, even when there is a stroke, we do not know what to do, what is the preventive care to be taken as we are taking the person to the hospital. But to identify a stroke, the first thing is that you should ask a person to repeat a sentence what you have spoken. And when a person has suffered a stroke, his speech will not be as clear as it was, and there will be a slight slur in his speech. It will not be very clear. With one symptom, we cannot conclude. So the second symptom is tongue. You ask the person to roll the tongue out and take it up to the lips. In normal conditions, we can hold it up to the lips and keep it. But when a person has a stroke, that time he will not be able to hold it, and the tongue will roll out on either side. On either side it can roll out, and that indicates that there is a possible stroke. If the tongue has rolled out on the left side, then the clot is on the right hand side of the brain, and vice versa. And the third test can be to ask the person to raise the hands. Today we can raise the hands and stand in this position in normal times. But whenever a person has a stroke, hand will fall off. He will not be able to keep the balance. And that is why we find that when a person who has a paralysis stroke, one side of the body is affected. So with this, we can identify and rush the patient to the hospital, because the first 4 hours are very, very crucial for getting the medical help and the attention. What are the pressure points that can be done in such a case? The thumb is connected to the brain and the head region. We have seen the pressure point should be done on the entire front of the thumb, which controls the brain, pituitary, pineal, mental and head nerves. So this entire thumb should be pressed and activated as you are taking the person to the hospital.